Good morning and good evening, fellow classmates and Dr. Wilson. My name is Marissa Hester, and today I will be presenting on childhood obesity. Childhood obesity is defined by a child's weight status. And how do you get a child's weight status? It is determined usually by the child's age and sex-specific percentage, along with the growth patterns. So if a child is greater than 85 percentile, the child is considered to be overweight. If the child is greater than 95 percentile, the child is considered to be obese. And this is from the CDC 2017. Upon my completion of a literature review, I learned that 1 out of 6 United States children are considered to be obese. Out of those children, 12.7 million of those children come from low socioeconomic status. This is from Frieden, Ditz, and Collins in 2010. Childhood obesity has generated a number of chronic disease processes. Some of those disease processes is heart conditions, diabetes, asthma, and also psychosocial effects on children. The growing epidemic has increased the annual spending of about $150 billion per year in the United States. This is from Childhood Obesity Legislator in 2017. Because of all the financial burden, all stakeholders must promote healthy children in our communities because of this growing epidemic. To design or develop a program, the research program planner must look at the current and past programs to see what has succeeded and what has not. Where did they get their funding? Who's vested in these programs? And also to look at evidence-based gaps. Now, to implement these programs in a local community, all interested groups must understand that this is a partnership. The program director must assess the local community needs, present this data to the stakeholders, and show all the gaps according to the national standards of childhood obesity. The 4 things that I've learned from doing a literature review on childhood obesity is, number 1, the lack of education on the general public. Number 2, the resources that are available on prevention or childhood obesity. Number 3 is how to develop or implement a program in a local community. Number 4 is how stakeholders affect national policies. Now, according to State of Obesity in 2017, there is a lack of education to the public on childhood obesity. So there needs to be tailored programs for local communities in order to understand and to educate the local communities on this growing epidemic. Number 2, our resources that are available. According to the USDA in 2017, there are programs such as childhood food programs, school meal programs. You have safe places to work out, nutritious foods, and also bariatric services. Some of these programs are not communicated to the local level. And number 4, how to develop a program. Well, the University of Nebraska Medical Center in 2017 says when implementing a new program. You have to assess the needs of that local community. Once you have done this, this will determine how you will develop and design your program, and this will drive the local program to meet those national policy standards and guidelines of childhood obesity. And lastly, the stakeholders affect the policy. When social and community planning is implemented, this creates a long-term and short-term goal for all policies. So both parties actually benefit from this. Number one, the community needs are met. When the community needs are met, the politician gets the votes. The politician also is the advocate for the local community to get that funding into the local community. And therefore, everyone is educated, knows where to go, and the resources on childhood obesity. This is from the Community Toolbox. This concludes my research and findings on childhood obesity, and thank you very much.